Greetings. There are basically 7 common signs which we can easily recognize and identify in a patient who is either having a mania relapse or has gotten mania. And these include 1. Excessive distractibility or destructive behavior. For example, a patient may be disturbing others, or you might find a patient exhibiting destructive behavior. For example, threatening to jump over a fully leveled flat or overspeeding using a vehicle. 2. Excessively increased interest in previously enjoyable activities. For example, a person who is a preacher or a person who likes reading the Bible or a Quran, you will find during a manic episode, he is reading more than he used to do. In this case, the mind is driving him to do the activity more times than he used to do. Or a person may be a footballer, and you find he's spending most of the time playing football or watching TV, which he doesn't do. 3. Excessive grandiosity or grandeur delusions. A patient who is having a manic episode, in most cases, they tend to have pseudo uplifting of their level. For example, a person may be a farmer, but he may find himself as the president of the country. Or he may say he's the general of the army of that country. Or a person may say he is the bishop, and yet in an actual sense, he is just a mere peasant. Next, flight of ideas. Patients who are experiencing a manic episode tend to have more plans, or they tend to have more ideas, or they tend to have a multiple of activities they want to perform in a specific period of time. For example, a person may want to play football, a person may want to go driving, a person may be singing, a person may be preaching, a person may want to fly in a short period of time, and yet it's not possible. For example, that's because their mind is having a stream of thought. Their thought are having a multiple of ideas to be exercised in a short period of time. Next, excessive appetite. Due to the excessive activity a manic patient is experiencing, the body tends to demand for more food, hence creating a higher appetite for food than normal. And in this case, manic patients, they also tend to have a higher libido for sex than before. Next is sleep disturbances. Due to their body demands for higher activity, patients in a manic episode tend to lack sleep just because of a higher body activity. And they end up being awake throughout night, either enjoying their activities they want to do, or disturbing others, or if a person is a footballer, you find him playing football throughout night. And lastly, we shall talk about excessive talkativeness. Patients who have mania, they tend to be more talkative than normal. For example, they might have a loud speech, pressured with many words, and which may be vulgar or not vulgar, and they are mostly coherent and valid. Basically, these are the 7 signs of mania I wanted to talk about. However, each patient may present differently, dependingly. Are you together? See you in our next video.